So I wanted to mention today about the use of curcumin together with chemotherapy. And in particular, there's a paper published back in 2020 where they use intravenous curcumin combined with chemotherapy, paclitaxel or Taxol, it's called, in advanced breast cancer. And it was I'm just looking on my screen here, a comparative randomized double-blind placebo-controlled trial, about 150 women. And I bring this up because it seems to be in practice, I'm always hearing how, there's this concern or fear how curcumin from turmeric could interfere with chemotherapy. It could, not make it work as good. And so it seems to be a constant thing that I tend to hear. And so I'm more about just like, what does the evidence show? Because we're talking about many drugs, many kinds of cancers. So here's a paper published in 2020 where I think it was a well-designed trial. And what they did is they were given the chemotherapy paclitaxel or Taxol, that's the other name for it, every week. And they also gave curcumin intravenously, so that's 100% absorbed at the same time. And there was a placebo where they didn't get the curcumin, and they did this for 12 weeks. So they did this 12 times combined together. And what they noticed was, it was safe, it was well tolerated, it appeared to help with fatigue, and they were looking at responses. The responses in the combination with the curcumin and the paclitaxel chemo was better or superior than just receiving the chemo by itself. So and again, you could look at other papers, mice studies, test tubes, but those are pretty weak levels of evidence. Here's a double-blind randomized trial. Yes, not all trials are perfect, but still, this is published and it's out there. And it was given in the form of curcumin that's aggressive, IV. I know we've used curcumin IV for many years, and so we understand its potential value in cases. So something to think about, that there is safety data with chemotherapeutic agents. And so this was just one that kind of came to mind when I saw some patients recently on how, listen, there are double-blind trials out there using this with chemo, and again, from a safety signal, it's not showing things of concern. So something to think about.